Thank you, Chairman, for the kind introduction. I would like to express my sincere gratitude to the organizing committee, Professor Kwang Lee, for the kind invitation. And dear colleague, the topic given to me is age limitation for donor and recipient in the context of beyond contraindication in LDLT. I'm coming from Jakarta, Indonesia, working in tertiary hospital, Fatmawati. This is my disclosure. I'm in Indonesia. Liver transplant is still developing. We started just in 2006, and Cipto Mangunkusumo Hospital is the leading center in which more than 100 liver transplant has been done, mostly pediatric, and my center has just started this year. If you look at Cipto Mangunkusumo data, the donor age ranging from 18 to 50 years old, same as the standard in many liver transplant program. When this topic was assigned to me, I tried to ask ChatGPT and also mention the age limit of 55 to 60 years old. Thus, I will discuss the expansion of age limit in terms of the why and how we can proceed. Let us start with the why. The population of people aged 65 and above is rising in every country and will continue to do so in the next couple of years. And with the increasing age, of course, we see many liver disease will be more profound, including MAFL, MASH, and DILI, and HCC will occur with the advancing age. Furthermore, a study from Ohio showed an increased percentage of surgeries in nonagenarians across surgical specialties. And we can see here that nonagenarians actually had a higher 30-day perioperative mortality and a longer hospital stay compared to octogenarians in any types of surgical procedures. A large cohort Korean study assessed the effect of recipient age of liver transplant outcomes. That recipient over 70 had a 3 to 4 times higher risk of death compared with those aged 51 to 55, even after adjusting for liver diseases and perioperative complication. Additionally, the cost is also higher. The results of liver transplant with nonagenarians liver grafts are also not significantly different from those obtained with octogenarian donors. Taking into consideration the small sample size of this article in the case series by Maestro Group from Spain, again, careful selection of patients and donor is very important. From a study from Professor Subhas Gupta group investigate the outcome of LDLT from 50 years old and older, shows similar early graft dysfunction, hepatic artery thrombosis, portal vein thrombosis, and bile rates with higher 30-day and 1-year mortality. Of course, older donor may pose challenges in the early postoperative period, thus proper selection is paramount. The effect of donor age and post-transplant mortality differs according to the recipient age and is greatest when young recipients receive older donor organs, even when adjusting for recipient severity of illness and other donor characteristics. Now let us turn to the how part. This picture shows changes happens as the liver ages, including its tendency to shrink, increase apoptosis, reduce immune cell functions, and increase steatosis. A retrospective study at St. Louis University underlined the importance of multidisciplinary fashion to assess the risk of complex medical and surgical care in nonagenarians. An extensive and thorough conversation regarding patients' wishes and end-of-life planning should be carried out. In order to expand the age limit, we must carefully select both donor and patients, starting with evaluation of cardiopulmonary function to ensure tolerance to significant hemodynamic changes during transplant surgery. Extra care with aggressive comorbidity management, including malignancy screening, nutritional status, and frailty management, should be the standard of care. And last but not least is the psychological evaluation in adherence to the medical instruction and support system. Duke Activity Index and Liver Frailty Index has been used to predict mortality in patients with chronic liver disease, in which increased frailty and decreased DAC are related to increased mortality. In transplant waiting lists, LFI can be used to subject the patient for improvement program to better prepare the patient. Those tools can even be accessed virtually to help more patients. To end my presentation, ladies and gentlemen, I would like to highlight that even though a careful selected patients of advanced age without medical comorbidities may be considered an appropriate transplant candidate, this practice must certainly be the exception and not the rule. In summary, Mr. Chairman, everyone, I can conclude that age should not be the limit in liver transplantation, keeping in mind that careful patient selection and utilization of multidisciplinary perioperative care to ensure safety of the surgery for both donor and recipient. Thank you very much.